Together we achieve victory over heart failure.
Hello everyone, myself Dr. Manjunath, and today evening I'll be discussing some facts about heart failure. Basically, today the discussion will be focusing on some of the common misconceptions that we are having around heart failure. So it will be a brief discussion. First myth or first misconception is the heart failure only targets elderly. Is that so? No. The thing is, the heart failure is actually, even though it is more prevalent in among elder adults, we do see cases which can happen in any age, including neonatal and childhood period. So, heart failure is not something that is confined to elderly. Even younger people like us can also have heart failure. So we need to keeping this in our mind. We need to make our lifestyle choices such that we can't the overall health of us be better in compared to not just the elderly. The next thing is chest pain is equal to heart attack. Is that so? No. The thing is, chest pain is actually one of the symptoms of heart attack. Okay, so heart attack basically means a acute coronary event. Okay, so something that has happened acutely. So most commonly, the chest pain, the patient with an heart attack will have a chest pain. Sometimes it can radiate up to the neck. It can go to the shoulder. It can go to the bilateral shoulders, not just the left side of the shoulder. And usually it gets relieved by taking rest. And this is what we call as a typical angina. But many a times we don't encounter this. Many a times, especially if the patient is having some diabetic, then many a times they do not manifest with this chest pain. So if the patient is having a heart attack, that doesn't mean it is not just in those category of patients who are having chest pain. There are something called as anginal equivalents. Okay, so it can be in the form of excessive sweating or vomiting, nausea. Okay, the patient some can have a giddiness, dizziness, even some loss of consciousness can also occur in patients who are having a heart attack. So we need to be careful and we need to distinguish chest pain and heart attack. And next conception around the heart failure is heart failure means the heart is not working. No, is that so? No. It just heart failure just means that the patient's heart is not able to give enough output or enough blood into the circulation, such that the body's requirement is not met. That is all. So basically our treatment focuses on this. Our treatment focuses on medications or lifestyles which usually improve this cardiac output, such that this failing heart, we provide support to this failing heart such that the patient does not develop symptoms. And then the next question is, does an long-term smokers can't lower their risk of heart disease by quitting? This is also one of the very big misconceptions, because there is something called legacy effect. That means what you do now, it will be reflected 15 years later. So if you are smoking today, effect of that smoking can happen like some 10 or 15 years down the lane, you will be getting that side effect. Similarly, if you stop smoking today, or if you stop any of the if you do a lifestyle modification, be not just quitting smoking, it can be quitting alcohol, it can be doing regular exercises, okay, maintaining a healthy food lifestyle, going for yoga, exercise, or gym, or any kind of physical activity. All these things you might need not get a good immediate effect. Your effect will be seen later. So similarly, even though you're smoking for, let's say you're smoking for 5 years, 10 years, and today you're having some cardiac event, and definitely if you stop it today, your life expectancy is definitely going to be prolonged compared to when you are not smoking, when you are smoking. So even patients who are smoking for past decades, they need to stop. Even patients who are smoking just for 1 or 2 days prior to them, they also need to stop. Okay, next the question is related to exercise and heart attack. So after having a heart attack, should the patient exercise or not? So many a times we think since the heart attack was there, we should stop there. No, that is also a misconception. We need to encourage the patients, especially those who are in heart failure or those who have had a acute cardiac event, to do exercises. They need not be the exercises which they need not go to the gym. They need not go to some be fit enough to compete for all this any such kind of event. They just need to do physical activities which keeps them healthy to their extent. Many times patients in the heart failure, one of the symptom is this effort intolerance, is what we call it as effort intolerance. So such patients we need to create an exercise pattern for according to their exercise limits. This is another misconception. So whatever activity you are doing in your daily lifestyle needs will have some effect on your cardiac status. So heart failure patients or patients who had heart attack, they should not stop exercising. And these are the few misconceptions that I would like to clear as of today's podcast. So the final take-home message is that proper care and treatment, in especially those individuals with heart failure, will help them lead a better life. I hope this was a useful session. Thank you.